Good evening, welcome to Win News. I'm Melissa Russell. Also making news tonight, the Queensland Airbnb host named the best in the country. A plane crash in the Southern Downs that killed its pilot is being investigated by Queensland Police and Recreational Aviation Australia. It's believed the pilot was flying a recreational kit-built aircraft when it crashed into a paddock off Palgrave Road in Palgrave, southwest of Warwick, at around 12:15 yesterday afternoon. The incident sparked a grass fire that was contained thanks to quick action from a local and emergency services. An urgent care clinic will be opening in Toowoomba next week, making it easier for local patients to receive treatment. Toowoomba Medical and Dental Centre will be transforming into the urgent care clinic from Monday, providing bulk billed care to patients who would otherwise present to hospital.
It'll be operating 7 days a week, extended hours, and available for walk-in patients who urgently need care for a non-life-threatening emergency.
But the federal opposition is concerned staff shortages could impact the viability of the clinic.
Every facility in our region is struggling to find people, and we're going to pretend that they're magically going to bring people here for this.
It's hoped the opening will take pressure off nearby Toowoomba Hospital, where 1 in 5 presentations are for non-urgent or semi-urgent care. Cost of living pressures are continuing to affect regional Queenslanders, according to the state opposition leader. David Crisafulli was in Maryborough talking to local business owners about issues affecting their bottom line.
As we've spoken and listened to businesses today, they've told us about what the rising cost of living pressures is meaning to them, but also to their clients, to their customers who are struggling every single week.
The opposition believes that Queenslanders are feeling the pinch because of neglect by state Labor.
When you look at the things that the state government control, power prices continue to go up and we've got power generators offline. Insurance continues to rise because of youth crime. Every household bill, there is an implication when governments don't value your money.
The spokesperson for Treasurer Cameron Dick told Win News the state government is helping more Queenslanders keep energy costs down, with coal royalties allowing Queenslanders to receive electricity rebates, something the Liberal government will be unable to do. Almost 2 months ago, the federal government introduced 60-day dispensing as cost of living relief. The backlash from community pharmacies echoed across the nation, but the projected financial damage to businesses is being offset by the prescribing practices of GPs, who've used the extended policy less often than anticipated.
For Brian Manning, a community pharmacist for 50 years, the last 7 weeks with 60-day scripts have been frustrating.
We haven't had it all spelt out for us very well. It's not coming out clear. They're making it up on the run. That's how I feel it's being done.
Twice the medication for half the price. That's the federal government's slogan, but what's the actual cost to patients?
The safety net is a big issue to people at this stage. People get free prescriptions. Under this, we understand that if they're getting 2 at a time, they won't reach safety net next year. So a lot of people have got this in mind and saying, I don't want double quantities.
Meaning chemists are yet to be dealt the anticipated financial blow.
They're happy with getting the 1 packs. They like to know that we're monitoring things. Where the doctor would have to see the patient every 6 months, they now don't have to see the patient until every 12 months. Well, on something like blood pressure, the doctor might think, I want to check on my patient more frequently than that.
And that they are.
It is really not make very difference for us, because if I need to see my patient in 4 weeks, that means I'm going to see them in a month's time.
Prescribing 2 months' worth of medication decided case by case.
It is up to us if we are happy to prescribe for the 1 month or the 2 months. I think some patients I'm happy to go with a 2 month supply, but I think most of the patients, they really need a monthly review.
But government MPs say that was always the policy's intended purpose.
It was always designed to be staggered over the next 18 months, and certainly that is to obviously transition and allow things to settle down.
Is there a greater benefit or detriment? Both GPs and pharmacists agree it's too early to tell. Olivia Blunden, Win News.
Regional Queenslanders develop an infection from a snake bite far less commonly than people living overseas, according to new research. Infectious diseases specialists from Cairns Hospital discovering that while Australian reptiles like brown snakes and taipans are more venomous, the snakebite wounds are actually less likely to become infected and damage the tissue compared to those from species found overseas.
The cobra and the vipers that we don't have in Australia tend to cause more ulcers and more redness at the wound site, whereas our snakes cause problems with breathing and blood clotting.
The finding is hoping to reduce the use of antibiotics globally for treating snake bites.
And finding out that actually you don't need antibiotics to treat a snake bite, that what we're seeing is actually more tissue inflammation rather than infection. A practical learning that will change healthcare.
If you are bitten by a snake, apply a compression bandage